There's a lot. 3, 2, 1.
Welcome everyone to our first ever virtual conference on hypoparathyroidism. We are so excited to be with you and to be a part of this. I appreciate all of you coming in from all over the world. We have people coming in from 22 different countries, and it is just an amazement to me at how we have grown and how we have learned. Before we get started, there are a couple of housekeeping events that I would like to bring up. Let me get my paper here. Number one, you will see that there's a comment column on the side. What you need to do is put your comments as long as they are at the subject or with the subject at hand. We don't want a lot of highs from all over because we have people from everywhere. Once you join in to our conference, your microphone is muted, so you can yell and scream at me all you want. Just kidding. And we will put the questions up per session as when the time is right. All the questions may not be answered, but if they're not, we will take them down and we will get them to the presenter, and then we will post them on our website. So before we get started, I'd like to introduce our board members. First, I'd like to start off with the president of our board of directors, and that would be Bob Sanders. So, yay, Bob! Hey. Oh, and he's from North Dakota. We are all over. Next, I'd like to introduce Loretta Gully. She's from Virginia, right? Yeah. I'd like to introduce Barry Vapnik. She's our new treasurer. She's from Boca Raton, Florida. And I'd like to introduce Michelle Reyes. There you go, wave, Michelle. She is from Texas. I'd like to introduce Patty Keating. She is going to be from, where is you? Oh, Virginia. And then Joellen Friedenberg, our webmaster Wiz, is from Virginia also. And I'd also like to introduce Amanda, because Amanda is the key to keeping our things running. Thank you, thank you, thank you. Okay, there's a few things I'd like to talk about, and then I'm going to turn it over to a few other people. But to start off with, I'd like to say goodbye to 2 of our board members who retired themselves. One is Daynette Astolfi. Without Daynette, we could never have gotten to the point we are. She has the wherewithal when it comes to clinical trials and a lot of the drug information, and she has educated us and instructed us and made us to be what we are today. And Daynette, she's just a rock star. I'd also like to say goodbye to Ruth Ann. She was a board member for a little bit. She helped us come up with our strategic planning, which was an awesome achievement, because trying to get us all together to figure everything out is something else. I would also like to take a moment to say goodbye to Julie Hunsacker. Julie passed away in July from pancreatic cancer, and Julie was a driving force in this association. Without her, we really wouldn't be where we are today. I really relied on her for her insight and her information. So now we've turned the page and we're into a new era. And our new era is a vision. Our new vision is a world without hypopara. Very plain, very simple, but very true. And it may take us our entire lifetime to find this, and it may take longer than my entire lifetime, But that's our goal. Our vision is to have a world without hypopara. Our mission is to advocate, to build up, to educate, to instruct, so that we all can be bigger, better, and more empowered than we ever have. That's it for me for the moment. I'd like to take it now and turn it over to Michelle, who will be talking about our silent auction. You're muted.
Thank you, Deb. Good morning, everyone. Welcome to the HypoPARA conference. So we are having a silent auction running, and the quickest way to visit the items that are on the silent auction is on your left-hand side of your screen, where you see the little people icon that says Teams. If you click on that, then you will see a list of items, and you can view each item individually. And if you click on the item, it will then show you a picture and give you a detailed description. Now for today, you can only view the items. You cannot bid on them yet. Tomorrow, once the auction opens, you can click on the items the same way, and then to bid, you will just type a chat message with your bid amount. And you can also message me that way to ask questions about any of the items. So go ahead and take a look today, see what you're interested in, and come back and bid tomorrow, please. Deb, you're muted.
Thank you, Michelle. That is awesome. We are very thrilled with some of the items that are up, and if anybody wants to try and bid me out of the frog, good luck. That's my item of choice. Thank you, Nancy Watson. I would like to take this time right now just to let you know, this is really weird, just sitting here at home on my computer talking to you guys. I'm so used to being together at our conferences and being, oops, sorry, that's the other thing that you'll have is my dogs fighting. But it's so weird to be sitting here with myself rather than being surrounded by you all. And I miss you all, and I hope that next year we can get together again. I'd like to take this opportunity now to introduce Bob. He's going to be sharing a little bit about himself and about where we want to go. So, Bob, take it away.
Hello, everybody. I don't know, for those of you who don't know me, I'm Bob Sanders. If you're new to the organization, or those who've been with the organization, you guys know my father very well, James Sanders. Like Deb said, Julie was a driving force. She actually was the one that pushed my father into getting everybody together because her daughter, like all of us, suffered from a rare disorder, and she saw the value in a community of patients getting together and sharing their stories and supporting each other and advocating for each other. Without her, this never would have gotten off the ground. And I can't thank Julie enough for all the work that she did, and she will be missed. But for me, Deb kind of wanted me to tell my story. We all have a story, and my story is a little different than a lot of yours, I'm sure. I grew up in a family of hypoparathyroidism. My father was born with it or developed it at a very young age, and he wasn't diagnosed until he was 21. Growing up, his childhood, he had doctors tell his parents that he was crazy, it was all in his head, he wasn't really sick, and he tried to do all the things that kids wanted to do growing up, sports and whatnot, but his body just would hurt. So he was alone, and he had no idea, and it wasn't until he met a doctor that when he was 21 that diagnosed him with hypopara. He thought he was, like a lot of us, he thought he was literally the only person with this rare disorder, had no idea what it was. He was involved in quite a few studies throughout the years. I met my mother, and well, I had five boys, no daughters, 5 boys. I'm the middle child. When my older brother, my oldest one, Jason, when he was 8, he was down in one of our close family friends' basements playing Nintendo, and he went into a grand mal seizure, and called the paramedics. They took him into the hospital, and to this day, he has the lowest calcium levels on record at the Eastern Idaho Regional Medical Center. I want to say it was 4.6. And how he survived, we don't know, but he did. So then that started my dad. So he's like, well, did I pass this on to my kids? I have no idea. So they tested Jason and confirmed that he had hypoparathyroidism. And then my other younger brother, he was the next one to get diagnosed, but he was diagnosed when he was 2. He had a lot of hearing problems. He had a lot of issues growing up that could be explained from hypopara, but he's doing really well now, but he's pretty sensitive. Misses his medication, he could end up in a lot of trouble. And he struggles to this day. He struggled getting jobs, holding down jobs because of his brain fog, just not being able to function in society very well. And he was diagnosed when he was 2. And then next, my other older brother, he was finally diagnosed, but I think he was probably 12 or 13 when he was diagnosed. And then my youngest brother, Stephen, he was diagnosed a little bit later, and I was finally diagnosed when I was 18 years old. We got together. What started this whole organization is Dad. He got in contact with Dr. Karen Weiner over at the National Institutes of Health, and was part of a clinical trial. I want to say it was for the 1 through 84, the very beginnings of Forteo. And he met a lot of wonderful people there, and he wanted to bring these people together and create this entity that we have. It's such a loving community. But as far as my journey goes, I've never been real symptomatic. I've felt blessed in that, and I don't know if that's because it's a genetic, if it's the genetics basis of it from the TBX1 genetic mutation that we have. I don't know, but all 5 of us boys, all 6 of us, we're all completely different. We're all unique in our symptoms. We're all unique in what we have, the medications that we take, and how we live in this life. Just like all of us in this community are unique, and that's what makes it so hard to treat hypopara, because we are different and we all have different symptoms. And a few years ago, I think this is what shifted the paradigm in the FDA, right? So years ago, when they were trying to get, I could be wrong, but I want to say it was Forteo to be off-label. The FDA said no, they would not approve it. And Dad invited one of the FDA head of departments to one of his conferences, and he got to talk to all of the patients. He said, well, if you're not going to approve it, then you need to explain to my patients and the people in my group why you're not going to approve it for off-label. And he did that. And then the best thing about our conferences is the question and answer, and the fact that the doctors get to listen to the patients and see what our needs are. And after that, Mom says that he come out and he looked like he had just been worked over. And the next day, Forteo was approved for off-label with hypopara. And then you see a paradigm shift. And I will make a commitment to you. I will get with my mother and get the documents. But she said over the next couple weeks, then you could see this shift going across the world, that the patient advocacy is extremely important in drug development, that it's not just black and white the way they were running things prior. And I want to credit my father for making those changes and bringing us all together, and all of us telling our stories to make those changes happen. And it just goes to show that a small group of people is the smallest there's not many of us out there, but we had a major impact on the medical world, the way and the pharmaceuticals and how everything is being done today. So that's that. I want to kind of talk a little bit more about me, I guess. So I met my wife working in Yellowstone, and we had 3 beautiful children. And a couple years ago, like I said, I've been living my life. I don't have to take a lot of calcium and just kind of take it here and there. And I took everything that my father did for granted over the last 25 years, because I guess I just live with it. And it wasn't uncommon to me because I was around it my whole life. And I didn't get to see the impact that he had on all of you. And then my daughter, my youngest daughter, Jocelyn, when she was 10 years old, in 2018, I want to say September, she had her first calcium crash and diagnosed with HypoPARA. We were in the hospital that night. And with all the information I have and all the education I have, I'm in North Dakota. It's a small community. It's a small hospital. I fought the fight that many of you have fought, and my heart goes out to you. Trying to get the emergency room doctors to understand what's going on. It was hard. It was hard. They were focusing on her symptoms. She was in severe full tetany. Her body was cramping up, and we were in the hospital for 6 hours before I convinced them to give her any calcium. And I fought and I fought and I fought. Gave them the numbers, personal phone numbers of Dr. Karen Weiner at the NIH, and they wouldn't do it. They wouldn't call because they didn't understand. And when they finally admitted her, and it wasn't until this 10-year-old girl was curled up in a ball on the bed crying, and she asked if she was dying, before the doctors and the nurses finally looked at me and said, "What do we got to do?" I said, "You guys have been focused on the symptoms. The symptoms will go away if we could get her calcium levels up." And I would love to say that, and that was the hardest thing. And then I was like, you know what? I'm gonna get involved, because this is hard. So we had the conference in Chicago, and that was the first conference I've ever been to. And I went, and that just happened to be the conference that my dad was stepping down from the board along with my mother. And they made their announcement, and I got to see all of you tell your stories and tell my dad how he saved their lives, how he would take the calls 2, 3 in the morning to help trying to convince doctors and nurses and ERs doing the same thing, that going through the same situation that I was. Morning, day or night, his phone was always on. And thanking him for making our lives better, for all the work that he had done. And it brought me to my knees. I was like, I got to get involved. I got to do more. I can't just sit on the sidelines anymore. So after the conference, they were doing their annual board meeting. We're eating pizza at this little pizza place right around the corner, and I think it was either Julie or Deb looked at me, and I think it was Deb. She's like, "So you're going to be a board member?" Pointing her finger at me. And I was like, yeah, because we had spots to fill. There needs to be work to be done. And I kind of joined on there. And I'm not going to say that, Jocelyn, it's been a challenge. And I'd love to say that's the only time that she's been in the hospital with calcium crashes like all of us. But it's not. She was just recently released last weekend. Ended up coming down with COVID-19. And a lot of us I know, have a lot of concerns about that. And with her particular body, whenever she gets sick, her calcium levels just crash. They crash hard and they crash fast. And COVID-19, a lot of kids, a lot of adults even, most people don't even see really a lot of symptoms. They're asymptomatic, but it was ravaging in her system. She didn't know, we didn't know. All we knew is she had a little bit of congestion, which we attributed to allergies. And we're doing a fundraiser at a fundraiser, unaware to what was going on, and she just collapsed and had a couple seizures right there. And by the time I got there, the ambulances were already there and took her in, and I was like, well, she's not symptomatic. She doesn't have any tetany. She doesn't have any cramping. Her Suboxone is fine. It's like, I don't think it's calcium, but we need to check that first anyways. Well, her calcium levels were lower. Ionized calcium, I think it was 3.4. And well, that's what it was. And then they did their COVID test, and I heard nothing from the test. And then little by little, the doctors were coming in with more and more PPE on, and the doors were shut. And I kind of looked at them, and I was like, hey, what was the results of that test? And they said, yeah, she's positive. I was like, oh, well, that's nice. She's doing really good now. She's actually getting labs, but that's just to check her levels. Ended up getting in contact with a really good pediatrician at the Mayo Clinic in Rochester. His name is Dr. Peter Tebben. He works directly under Dr. Clark, who's on our medical advisory board. In fact, he's the one that covers for Dr. Clark when he's usually attending our conferences. But we're fortunate enough to have Dr. Tebben speak on Sunday in regards to pediatrics with hypopara. And I think he's even going to touch base on pseudo-hypoparathyroidism a little bit, because he was asking if there's any patients here have that. And there was just coincidentally this morning on Messenger and on Facebook, there was a thread going around with pseudo-hypoparathyroidism. So I'm really looking forward to his talk. But like, where are we going? Deb, you know, we have that lofty vision statement, right? It's a world without hypoparathyroidism, and it's huge. It's a big statement, and it's going to take a lot of work to get there. And there's a lot of cool things coming down the pipes, right? Like in previous conferences, we've heard about stem cell research, which we'll hear from Dr. Krause about that later on this conference. And we've talked about at-home calcium receptors, and that they're working on. I don't know where we're at in there. Hopefully, we'll find out some things. I know there's just a lot of developments. We got new drugs on the market. Forever it was just calcium and calcitriol, and now we got Forteo for a while, and recently we had Natpara, and unfortunately it's under recall. And I know there's potential disruption issues on the most sensitive people in our population, and my heart goes out to you. But let us be sure that we are working with Takeda, and we're working with our medical advisory board, and we are trying to do everything we can to give you guys the best tools that you have at your disposal. So if there's any questions with your doctors, we're there to help you. And we are setting up, this is just for the people that are affected with the disruption, the 100 microgram doses that we are working. We talked with Takeda, and we're working on setting up a conference call with you guys with Takeda next week. So we'll let you know as soon as those dates are set and what times those are, so we could get those out. The mission statements kind of tells us how to get there. I know Deb tipped a little bit of it, but it's to improve the lives of people impacted by hypoparathyroidism through education, support, research, advocacy. Some of the things that we want to do to hit those marks, especially on the education. COVID-19 has ravaged this year. We've all been affected greatly across the world. And doing this web conference, it kind of opened our eyes. I guess this is one of the blessings that comes from the COVID-19 shutdowns. To realize, you know, we could reach a lot more people this way. And I'm telling you right now that we're never going back. All the conferences here moving forward, they're going to be hybrid. We'll do them live because we love the people, that personal interaction. But we're going to do these on the web as well, broadcasting across the world, so we could reach many, many more people. It's also taught us how we could do webinars, talk with doctors and bring doctors. I know we were hoping to get dentistry. I know a lot of you had wanted to talk about dentistry, and we had a Dr. Greenhall lined up, but unfortunately he's at another conference this weekend. But he agreed to do a webinar, and I was like, that's cool. And we're looking at trying to put those on at least quarterly, but we're going to try maybe monthly if we could get the funding to do it. But I mean, it's not going to be an easy task, but it's something that I think we need to shoot for to get the word out. So as you guys have topics and things like that, please get on the website, visit it, and put in there things that you guys are concerned about and worried about, so we could put some of these ideas together and help educate you and put you in contact with the right people. One of the other things that we were looking at, and thanks to Danette, and I want to thank our sponsors, I guess. I probably should have done that beginning. All of our sponsors, we have Ascendus and Takeda, and Amylite and Calcilytics, and they're all doing wonderful things and helping us out in ways that we couldn't put this on without them. And in working, we just released that survey on World HypoPARA Day, the Voices of HypoPARA, and if you haven't seen it yet, we will get it on the website. I apologize. I should have had it on the website the day it was released with the ASMBR conference. I kind of dropped the ball on that, getting ready for the conference, but I think Ascendus is going to have a little bit posting that, sharing a little bit of that information with you. But that was 156 patients of you guys that put input into that survey, and we need your voices. We need your voices because, like I mentioned earlier with the FDA, one of the things that now that when we're developing new drugs, when these pharmaceutical companies are developing new drugs and new therapies for different, not just our disorder, but everyone else, they have to get a patient's voice in there. And that kind of leads me into one of the other things that we're looking at is starting to work with the FDA. We want to get a PFDP, which is a patient-focused drug development survey. And for that, we're going to need a lot of help. We can't do that one alone. I'm reaching out to you because we need to hear your stories. And we'll get together with the FDA, set a meeting in place. We already got working with the gentleman and his firm in Washington, D.C. to help navigate those waters. Hopefully after this conference, we'll be able to really kick that off and start moving that ball forward. But we're going to need your stories because it's going to help paint a picture of who we are, what we're going through, what we need to see as a quality of life, because all that goes into whether or not these drugs could get approved for market or not. And it's going to help with move the trials a little further, a little faster. I know we did one with Takeda. I know we did a little one and with Ascendus. We're working with Calcilytics right now, putting together a patient advisory board for them, really for the similar purposes, right? Because they need our input. They need our stories. It's very important. I was talking with Deb yesterday, and she's like, you know what, we should maybe start working on a natural history study. And I never heard of that. I don't know what that is. And she's like, well, no, it's an ongoing study, and it's going to survey our population, our group, from here moving forward to see how we progress through time and how life changes and how our quality of life changes. I think it'd be kind of neat to see over changes, over time, things like that. I know a lot of you were impacted by the Takeda or the NatPara recall last year. One of the things that I mentioned to Bill Burke when we start doing these PFDPs and working with the FDA is one of the main goals that I have in mind, and this is dealing with orphan drugs of all types for all different disorders. There needs to be something in place legislation-wise that the FDA can't come out and just take a drug off the market, especially an orphan drug, without understanding the impact it's going to have on the population and how we're going to transition people back to normal standard of care. And there has to be a solid plan, because what happened with NatPara was so hard for many, many, many of you. My heart goes out to you, because I seen the struggles that you guys were undertaking as you were transitioning all of a sudden back to standard of care treatment, calcium and calcitriol. So I think those are some of the things that we can do as an organization. But again, we're gonna need the help of all you people. One way we get in contact. So when these pharmaceuticals, or just not even pharmaceuticals, but people doing surveys or different groups from around the world are coming to us, they're asking for our input. And one way we do that is we have an email list of everybody that's registered on our website. So if you go to our website, there's no charge. And that's one of the first things that we did as a board, is there used to be a membership fee, and we decided that we don't need a membership fee. This information, it's about information, and it's about helping each other and coming together as a community. So everything we're doing is off of donations. But we only have about 1,500 people on our email list. I know we got about 5,000 people or so on Facebook, and there's roughly 70,000 people in the United States, right? We got a long ways to go, and we're making good progress. Don't get me wrong, but I mean, I would implore all of you that are on, if you already haven't, go on the website and sign up. And that way, if you're interested in doing trials, if you're interested in doing surveys, then that's how we're going to communicate to you. We'll try and do as much as we can on Facebook and on Twitter. And I want to thank Barry for really taking us into the 21st century, because before we're not tech savvy, but she's like, dude, I got this. I got this whole Twitter thing. I got this Facebook thing. And so she's been a rock star. And it wasn't until she got online on Twitter, and then we really started seeing our presence around the world take effect. We're starting to see people from literally, like Deb said, 22 countries from around the world. It's awesome. It is amazing, the work that we're doing. I'm so excited for the future, and I don't know if I have anything else. Like I said, I'm so excited for the future of this organization and what we could do together as a community. And I want to thank all of you for attending this conference. In person, it's great. I think this is awesome. 520 attendees, and on average during our live conferences, we'd have about 120, 125, somewhere in there. So 400% increase, and we couldn't have done it without you guys. Again, I want to thank our sponsors and all those who have donated to the cause for all the work that you guys are continuing to do for us. I guess we could bring Deb on, and if you guys have any questions that you want to ask us or any of the board members, we go ahead and type them in the chat room, in the online chat, and then that way we could go ahead and try and get some of those answered.
There were a few, Bob, if you'd like me to read them out for you.
Yeah.
Awesome. One person asked, what enhances calcium absorption?
One of the drugs it's calcitriol. It's that active form of vitamin D. That's one thing that'll increase your calcium absorption. Getting out in the sunlight, that's going to help you too. I know it's been a challenge, especially with the shutdown. Do you want to bring Deb in, Amanda? She has some stuff too.
Yes, I'm so sorry. We're doing it now. Deb, you're muted. Deb,
Yeah.
you're muted.
I'm assuming we're doing a mime game, guys. I'm getting she's eating diet.
All right, here we go. The other thing that really helps is eating. Your food helps your calcium absorb into your system. So it's a multitask system. We have to have that vitamin D, that active vitamin D, but then we also need the food that will help absorb the calcium into your system. A lot of people talk about having high phosphorus, and you can go to your doctor and request calcium acetate, which is a calcium that binds with phosphorus. It helps, but that's one of the other things. Okay, Amanda, any more questions?
Yes, there are. There were was another person who asked, with whom did Bob say Takeda is setting up a Zoom meeting? Was it NatPara?
Yeah, so for those who haven't heard, NatPara or Takeda had a press release the other day. We posted it on social media. We put it on our website. There is a potential disruption in their manufacturing process for the 100 microgram dose, only the 100 microgram dose. So those people who are on the special use program right now, who are taking the 25, 50, or 75, we are not, there is no disruption in your guys's medication. They're working hard to get this manufacturing disruption solved ahead of time so we don't have a disruption. But worst case scenario, they said we're looking at November 21st before we're going to see any effects from that. So unlike last time when during the recall, they ripped the Band-Aid off and FDA said you have to get it off the market now, and then it was just that way. We have a month's notice because of what they have in stock. And so we have a little bit of time to work with those patients on the 100 microgram doses. I think there's only 174, right? 172 patients on that dose, so it's only going to affect those. And like I said before, unfortunately, I understand that is going to be the most severe cases, and our hearts are going to go out to them as they transition back to it, and hopefully they don't. And there's no guarantee, but they're trying to be, Takeda is being as open and as transparent as possible right now with the community. And they want, like I said, we suggested that we have a meeting with them next week. So those people on that 100 microgram dose, like I said, we will post that information out and then we'll let you know how to get into that meeting.
They're supposed to be emailed.
Yeah.
Specifically.
So.
Awesome. Excuse me. There was another question, which I believe one of our moderators responded saying there's a session later on the weekend about this, but the question was, can you define pseudo-hypo?
I actually had to look that up today. I'm not real familiar with pseudo. Are you, Deb?
No, it's one I'm learning.
Yeah, and I love our Facebook group because they're so educated. I mean, I learned so much from Facebook. I will try and get back to you. Hopefully, Dr. Tebben will have a little bit more information on pseudo hypoparathyroidism. From what I gather in the Facebook thread, it's, and like I said, don't quote me on this because I'm not well versed with pseudo. The treatments are similar, but they're a little different. One person said it had higher PTH levels. So I don't know. Honestly, I don't know. I said we're all learning, and there's a lot that we still don't know. And we need these questions, and I thank you for the question because it just gives us something to look at and to work on. So
Awesome.
I will try and get more information on that.
The next question that came in was, well, firstly, Deb or Bob, we could write it, but would someone just say the kind of calcium you just mentioned previously?
Calcium acetate.
Okay, go ahead.
Yeah, calcium acetate.
Awesome. The next question was, could you talk a little bit more about the drug company advisory boards and how can we become involved with them as patients? I like what you said, and it's important for patients to be involved.
So I think Calcilytics will be talking about a little bit about it later on this conference, but they're getting ready for one of their trials, and I think it's their phase 2 trial, and one of the things that they needed was a patient advisory board. And so they reached out to us and they gave us the parameters. So what we did, they said these are the parameters of the people that we're looking for. So we send out an email to everybody that we have on our email list. And of those that responded to the email list on that email chain, we got back. It kind of vetted them out and created the medical advisory board. Now that particular one is rather small. And I could bring Michelle in for this one because she's going to be our representative on the board. but I believe they're planning on changing it out periodically to get new voices. Is that still the plan, Michelle? Anything?
Yes, that is still the plan. The current board that just started about 2 weeks ago, the plan is to have them sit on the board for approximately 6 months and then change it out and get new stories. And I think our first meeting went really well. We got a lot of good information, and they're looking at expanding the program because of the participation.
Yep, and this is why it's so important to, like I said, I get to the website and get on that list so we could get you this information. The surveys, some of the stuff, depending on what the need is, we'll just do a media blast out on social media. If they're looking for something a little more specific, then we'll just we'll do the emails out to the community that way.
The other thing we've been doing is if you sign up to be a part of one of our smaller communities, like on the website, you can sign up to be a part of a different committee. And I've used those committees and send out emails to just those people, asking them if they wanted to be a part of certain groups. Because we have new groups and people wanting us all the time. So sign up, please.
Awesome. Another question came in, and I believe this was in regards to a previous one. Can't those patients switch to 50 mcg bid?
So again, we'll have to get with Takeda. They're looking into that as one of the potential options. They got to make sure that increasing that is not going to have an impact on those on the 50 right now is basically where they're at on that. They just, but yeah, that was one of the options that they were talking about. There's a couple options on the table and I can't really get into them. But hopefully, like I said, they'll get everything sorted out. We won't have to have this shortage. But that was one of the options they were looking at.
Perfect. The next question is, do you have names of doctors and endos that are familiar and treat hypopara in Idaho?
So what part of Idaho? Well, I guess I can't talk to you in person. They're one of the good things about this organization. They're growing up. Like I said, we're in Idaho Falls, is where I grew up, and the doctor there, his name was Barry Bennett, and he's actually on our medical advisory board. All he was a family practitioner. But it's so important that when you guys go out and you're looking for your family practitioners or your doctor, try and find one that's willing to learn. That's what Dr. Bennett did. Is he realized that he had a family of boys essentially that had hypopara, and he took it upon himself to educate himself the best he could. So he took a lot of the information my dad gave him, and he called other doctors on the medical advisory board to get information so we could effectively treat us. But we're all, and he's not an endocrinologist, but I would say he's a specialist in hypopara. He definitely understands how to treat it. That was one of the other things that we were looking at doing is expanding our medical advisory board. We're also looking at reaching out to the community and coming up with just doctors that you guys as patients use, and we could build that database on the website as well, so you guys will have a list of doctors. I think we got a couple, but we're still working on putting those together.
The list we have is really, really, really old, and we're trying to update it and get it better going.
Awesome. It looks like the person was from Burley, Idaho, Bob.
Burley?
Yes.
Yeah, so that's about an hour from Idaho Falls. Like if you hit up Dr. Barry Bennett at the East Idaho Family Practice, he's really good. He was basically our endo growing up.
Awesome.
And then I suggest to the community, we'll try and set that up on the website. We'll get with Joe Ellen, our website guru, and we'll try and set up a channel to where we could take recommendations from you as patients of who your endocrinologists are and who your doctors are, people that you feel do a good job in managing your cases. And, and hopefully we could expand that.
Awesome. We do have 2 more questions, but there's a nice comment I want to read out from somebody that said, "Thank you for all that you do. Finding this organization has helped our family. I'm excited for today's speakers and events." Just want to let you know. The next question: if Takeda is manufacturing Natpara, excuse me if I pronounced that wrong, to keep up with the special use program, then why are they not giving it to all of us?
Say that one more time, Amanda.
Of course. If Takeda is manufacturing, I'm going to spell it for you, Bob, Natpara, Natpara,
Yeah.
okay, to keep up with the special use program, then why are they not giving it to all of us?
Because the guidelines on the special use program are very restrictive. It's basically, it's one dose, just one dose, right, out of their lot. So before it was, they'd send out a pen and it would be multiple doses, and now you can only use it once because of the issue with the recall that they're still working on. And like I said, we were talking with them and they assured us that this would not have any impact on the timeline of fixing the issues that caused the recall in the first place. So both these issues, they're completely separate, independent of each other, and they're not going to affect one versus the other. You got anything else to add on that, Deb? I mean, those are some questions that we could ask Takeda, I guess.
Yeah, it's right now the pens are only used once, and it's a 14-day dose. So the fact that they can only use it once instead of using it for the whole 2 weeks is the big issue, because they're having to waste a lot of product. So I am very surprised, as well as a lot of people, that the special use program came up, because normally that's not a thing the FDA does. And they realized what kind of hurt taking Natpara off that way had for us. And so they gave Takeda the opportunity to help out our special friends who had a really hard time.
And I want to say this is the first time they've ever issued a special use program for any drug. So I wish I had a better answer for you, but I don't. Like I said, like Deb said, was the amount that they have to produce just to give to one patient is astronomical. So basically what a patient takes in 1 month is a whole year's supply. So that's why it is what it is. It's just so much that they have to manufacture.
But we have 3 other new drugs that are on our way. I mean, it's not, I know I love Natpara, but we also have so much to look forward to in the next few years. And I know that's hard to say, the next few years, because I'm in that program too. I mean, I'm in that spot where I wish I could be on it yesterday, but I'm not. But we have new drugs with Ascendis, the TransCon, and they'll be starting their final phase 3 trial shortly. And then we have a new drug with calcilytics, and we also have a new drug that they're working on with amylite. And so it's not as if our options are limited right now to just what we have. Well, they are, but there's just hope. There's things to look forward to.
Awesome. Just due to the time, just so you know, there's about 3 to 4 minutes left. And so for everybody who asked questions, there are still a number of questions here. I will be sending those to Deb and Bob after today, so they can always get back to you via email, but we will get those questions answered. I think there's a good one to end on, Deb, that I'm going to ask as probably the last question for this session. And that would be, what advice do you have for how to handle doctors who are unwilling to believe that our symptoms are real? This happens each time I have to go into the ED. I had an ICE letter and was still questioned. I'm usually labeled as anxious or drug seeking, and know I'm not alone.
Well, number one, look for a new doctor. I've had to do that numerous times, and there is no easy answer. The only thing I can say is if you find a doctor who is willing to talk to somebody else, then we can try and hook you up with someone on our medical advisory board who can talk to your doctor.
It's real quick, Amanda. It's hard. Like I said, I've been going through that every time my daughter goes into ER for her crashes. But for me, thankfully, I'm getting different doctors every time because it is an ER. But it's getting easier and easier. So the hospital is they know me and they know my daughter. They're starting to get to know us and some of those issues. So that may be something that you could do is if you get a doctor that's willing to listen, just go talk to the head of the hospital and say, this is the situation that I'm in. And just try and go that route too. Because that's what we've had to do is go talk to the hospital itself and just let them know this is the situation and this is what's going on. So this last time, it was the first time I've ever been in there and they're like calcium stat, and within 30 minutes of being there, they were already giving her calcium, IV calcium. Never had that happen before. So it's hard. It's hard, but it takes a lot of patience. And like Deb said, if your doctor's not working for you, find a new doctor. We had to do that with my daughter. So
the other thing is we need people to write their stories. We need to get the stories out. We need to write letters. Like I've written letters to hospitals when I've heard about how some of our patients have been treated. I will write a letter to the hospital advisor or board and say, listen, you need to take us seriously. So we can't just stay quiet. We have to start speaking out.
Thank you for that. And just because there's one more minute left, great thing to end on, Bob. I really want to say this out loud to you. Someone wrote, hi, apologies Hassan if I butcher your name here. I am Hassan Fadul from Bahrain.
Hi, Hassan.
Okay, perfect. I don't have a question. Just I would like to say that I'm so glad to join this conference. I'm so glad to see you, Bob. Your father is my inspiration.
Aw. Thank you. Hey, Mom talks about you all the time. They love you. Hopefully next conference we'll bring you on. We'll get you as a speaker.
Awesome. And then like I said, everybody else, for those who ask questions, I will get those to Bob and Deb by the end of the conference so they can outreach to you guys as well. And I'll just pass this over to wrap it up, I guess, to Bob or Deb.
All right, well, our next speaker will be Liz Glenister from the UK. She's going to explain how their organization works, and they've changed their name now. They're Parathyroid UK. So we have 15 minutes to go potty, drink a cup of coffee, and we'll see you back in about 15 minutes.
And Amanda, right? So they leave this session and then they do the same. They register and join in the next one, correct?
Exactly. So you'll leave this session, do what you need to do. When you come back on your VCM home screen, again, on the left, there's a VCM icon. You click that, that's your home screen. Your schedule is on the right, and you will see the session that starts at, let's see, 9:15 a.m. Pacific. It's called What's Happening in the UK. Press register and join. And that's it.
Thank you.